So we have just time to answer some of your questions. James, I'd now like to hand over to you, please.
Thanks, Anne. Interestingly enough, one of the main questions that keeps coming up is related to what you just mentioned, which is when might that clinical trial start? Now, obviously, we would love to start that trial now, but obviously we're not quite ready to do that yet. We do anticipate currently that the trial probably would be ready in the next, that classical 3 to 5 years. However, it really is funding dependent, and we really do think that if we could have an injection of some funding, probably in the order of that, $6-7 kind of $1 million range, we could actually get this trial started within the next couple of years with that kind of injection. So again, it's just really highlighting how important that appeal you just mentioned was. So for those of you out there hanging out for the trial, we're working as quickly as we can, and only with your support can we make that go faster. Another question that's coming up quite often is related to one of the things you mentioned, Sophie. It's around you said there's nerve controlled hunger and fullness as well, and so there's some questions around, does that mean when my device turns on I'll start feeling hungry or full, or could you explain that a little bit more to us, please?
Sure. Yeah, that's a good question. Yeah, I mean, certainly the vagus nerve controls things like fullness and hunger, and also digestion. So the short answer is we haven't seen any of these changes in appetite, or indeed, digestion, how often you poop, for example, in the clinical trials that have gone before. And so patients seem to eat regularly. They have no experience of feeling of change of appetite, and certainly digestion isn't affected. So it seems that when you stimulate this particular nerve, when you have a certain condition, it seems that the effects are related to the immune system.
Thanks, Sophie. Another question that's come up is a couple of questions for Nick. One is, could you just explain what a DMARCs is? And also, could you just explain a little bit more about when heat therapy is used and when cold therapy is used, if that's possible?
DMARDs, they're the disease-modifying drugs that we had, that Evangelos mentioned before. So, drugs like methotrexate and sulfasalazine. So, as I was saying in that slide, as a result of these particular drugs, we are seeing far less of it. So when I was training at university, we'd be making a lot of splints that were basically designed for very significant deformity. But since DMARDs have been sort of widely used, we've been finding that we're seeing a lot less of that. In relation to the question about hot and cold therapy, heat therapy generally, such as using a wax bath or hot water soak or a hot water bottle, anything that can get heat to the hands is often going to be useful, because it basically helps to improve the flexibility of the actual of the joints. The synovial fluid tends to become less viscous, which means basically the joint can move a lot more easily. So along with that comes not just improved movement, but you also get less pain, which is obviously very, very important. When it comes to inflammatory conditions like rheumatoid arthritis, when people are having flare-ups, sometimes using cold therapy like a cold pack can often be useful. But I would probably say on average, I'll probably find that most of our patients, when their disease activity is very low, that heat is usually the more preferred method to try and get improved movement and reduce pain.
Great, thanks, Nick. And one final one I think we might be able to squeeze in for you, Sophie. This vagus nerve stimulation is meant to turn down that inflammatory pathway, but you mentioned it's actually also a really important pathway. So are we going to end up with a lack of inflammation around the body?
Yeah, well, look, that's a really good question. So as far as we know, vagal nerve stimulation acts really well when the immune system is flaring up. And when the immune system is, say, at regular normal levels, say when a patient with arthritis is not experiencing such intense inflammation, we do believe that the vagal nerve stimulation won't have such a pronounced effect. And certainly won't lower the immune system to be sort of below what it should be. I guess the analogy I always think of is when you take a Panadol for a headache, your headache goes away. When you take a Panadol without a headache, your brain doesn't go numb.
Great analogy. Thanks, Sophie. And unfortunately, I think that's all the time for questions we're going to have. So if we didn't get to yours, we're sorry. We'll try and get to as many as we can after the event. I'll hand back to you now. Thanks, Anne.
Okay, thanks, James. And thank you to all our speakers, James Fallon, Sophie Payne, Evange Romas, and Nick Antonio. So I hope you enjoyed this information session on rethinking rheumatoid arthritis. I hope it's given you food for thought. And I hope that you'll stay in touch with the Bionics Institute community and see how this work progresses. Thank you to all of you who provided addresses at registration. We'll be sending out jar openers to you very soon. Jar openers, like Nick mentioned, can be very helpful for those with hand issues. Thank you very much for joining us. Thank you for supporting us, and we look forward to staying in touch with you. Thank you.